Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, March the 17th, week 54 in the COVID-19 pandemic here in Montgomery County. And today I am joined by my colleague, Commissioner Ken Lawrence. I'm going to start with an update on our vaccination efforts. Our 2 mass vaccination clinics remain on track with first and second dose clinics. Our Montgomery County Office of Public Health received all necessary second doses for this week, and our first dose clinics are running smoothly administering the Pfizer vaccine. Happily, our supply increased slightly this week. Over the next 4 weeks, we will receive at least 5,850 doses of Pfizer for our first dose clinics. This is an increase of about 1,000 doses per week. With this increase in vaccine, we are ready to open our 3rd mass vaccination site in Willow Grove near the mall. The site will be operational starting this Friday. This is welcome news because now everyone who gets an appointment with us will be able to choose the location where they go to receive their vaccine from among the 3 sites that are currently open. This, I hope, will make it easier for people to find a location that is the most convenient for them. We continue to communicate to the Pennsylvania Department of Health that we have the capacity to administer higher quantities of vaccine. This includes our Office of Public Health requesting more vaccine each week. For example, this week, we requested 10,530 doses of Pfizer, but we received 5,850 doses. For next week, we have requested 23,400 doses, which was the maximum amount that was allowed to be requested. I want to be clear that the county mass vaccination sites had the capacity to deliver more than 23,400 doses in a week, but that was the maximum amount available to be requested. We will find out later this week how many doses we will be approved to receive for next week. Similarly, our team submitted a proposal to the Pennsylvania Emergency Management Association to distribute the Johnson & Johnson vaccine as part of a regional approach laid out by Governor Wolf and the COVID-19 Vaccine Task Force. We're very grateful to both the governor and the task force for working so hard to make more vaccine available to our region. Once the state has finished vaccinating teachers, school staff, and child care workers with the Johnson & Johnson vaccine, the governor has stated that the next supply of the J&J vaccine will be made available to regions and counties throughout the Commonwealth. We're hopeful that we will be able to secure a fair share of this new supply of the J&J vaccine to target frontline workers, first responders, and continue to work through our 1A waiting list here in Montgomery County. If received, we'll be able to vaccinate remaining law enforcement personnel, correctional staff, grocery workers, career and volunteer firefighters, as well as meat processing and agricultural workers, in addition to those waiting on our list. We hope to be able to share more details with you soon. We don't really have more details than that today. In the same announcement this week, the State Health Department issued an order stating that all remaining people on the Phase 1A list are to be scheduled for their appointments by March the 31st. Right now, here in Montgomery County, we have approximately 127,000 people remaining on our 1A list, and that number does continue to grow each day. We will comply with the state's order. However, with this number of people on our list and our current vaccine supply, we estimate we will be booking 4 to 5 months out for appointments. If our supply increases, we will be able to move through our pre-registration list more quickly. And so if people do get appointments, they should keep an eye out for a possible change in that appointment as we get more vaccine. But at this point, we do need to schedule vaccines along the lines of the doses that we've been allocated. Finally, the governor also lifted certain targeted restrictions on restaurants and other businesses, as well as increasing gathering limits effective April the 4th. Montgomery County will comply with these new guidelines. However, we do want to caution that mask wearing, social distancing, and business adherence to all safety orders are still imperative. The importance of this is underscored by the fact that we now have confirmation of 24 cases of the B117 variant in Montgomery County. So this is no time to let up and throw that mask away. Not yet. We still need to continue to be very cautious until we get far, far greater numbers of individuals vaccinated. For the latest guidance and updates, businesses are encouraged to visit the COVID-19 guidance page on our website. That can be found at www.montcopa.org/COVID-19 guidance. So montcopa.org/COVID-19 guidance. This page has all of the updated orders and resources for businesses, schools, and other industries in the county. Our pre-registration for the COVID-19 vaccine remains available by phone through our COVID-19 hotline, which you can see on the screen in front of you. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. To pre-register for the vaccine by phone, you can call the hotline at 833-875-3967 and let the agent know that you need support in pre-registering for a vaccine appointment. Once your information is in our pre-registration system, it will be placed in line to receive an appointment. When we have a vaccine for you, a volunteer will call pre-registrants back once an appointment slot has been made available to book a vaccine appointment over the phone. There's no need for callers to have a valid email address or internet access. We also want to remind residents that no-cost transportation is available to all vaccine appointments. There are currently two options through Transnet and SEPTA for anyone who needs a ride to their vaccine appointment. The Transnet phone number is 215-542-7433. The SEPTA phone number is 215-580-7145. And coming soon, hopefully by early next week, is GoGo Grandparent. And this phone number is 855-464-6872. And this is a service that connects people to companies that provide rides through applications that you would normally access via a smartphone. But this takes the need for that smartphone out of the equation. So you can still get connected to those rides without having a smartphone. And again, all of these options will be no cost for Montgomery County residents. So how are we doing? We'll put up our weekly vaccine graph here. For those of you who've already pre-registered on our site, we do continue to send weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. We've been working through our individual pre-registration list and continue to vaccinate roughly 5,000 people per week. We're also cleaning our list and removing from our list people that have received their vaccine elsewhere. So as of this morning, we have 127,718 people remaining on our 1A pre-registration list. To date, we've sent 83,442 appointment notifications. So we are making progress. You can see from the top row on this graphic that as of yesterday afternoon, we've received 51,170 doses to the Montgomery County Office of Public Health. We've administered 43,486 of those doses, again, as of the end of the day yesterday. So with yesterday's delivery, we have a little over 7,600 doses left. We are giving over 1,000 doses a day at this point. And so we're continuing on this pace where our inventory is just about exhausted by the time we get the next delivery. At this time, depending upon when you registered, it may take up to 12 weeks before you hear back from us about scheduling an appointment with our current rate of supply. And as a reminder to check your progress, you can go to montcopa.org/COVID-19 vaccine and click the link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date you registered, you can see approximately how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January the 18th. So we've made some real progress since last week. The website also displays a running total of how many doses of vaccine we've received and how many doses we have given. So in terms of where we are, in terms of doses given, you can see in the bottom left corner of this chart that in terms of all places, all Montgomery County residents, no matter where they've been vaccinated, we have, or I should say the Pennsylvania Department of Health has record that 115,037 Montgomery County residents have received one dose of either Pfizer or Moderna, and that 71,930 have received both doses. So in total, 186,967 Montgomery County residents have received either their first or both doses. If we look at that as a percent of our population, if we take the entire population into account, that represents 22.5% of our population have received either one or both doses. And if we look at this as a percent of the eligible population, that means that anyone who is under 16, we take out of the equation since they are not yet eligible for vaccine. We've now got 27.77% of Montgomery County residents that have received either one or two doses. Or in the case of the Johnson & Johnson, received that one dose, which is all they need to be considered fully covered. So we are making progress here. In terms of our race and ethnicity data, our Asian community, which is about 7.7% of our Montgomery County population, in terms of the percent of vaccinated population, is 0.6%, a small improvement from last week. In terms of our Black or African American community, we see a 4.4% of the vaccinated population has told us that they are Black or African American, compared with 9.6% of our population. Individuals that identify as white are overrepresented in these numbers, as you can see. They are 85.6% of the vaccinated population, but make up 78.8% of our population. And individuals that identify as other or multiple races are also somewhat overrepresented here. They are 9.4% of those vaccinated, but make up 3.9% of the population. Again, and that's by the census numbers. We continue to have 1 in 5 people who choose not to identify their race, and 1 in 3 people who choose not to identify their ethnicity. And again, I would continue to urge people to please answer those questions. We use this as the best gauge of how we're doing in reaching every person in our community. Our goal here is to leave no one behind in this effort. We want to make sure that we get vaccine to every person who wants to be vaccinated, and knowing how we're doing in all areas of our community is extremely important to us, so we know where to target our efforts. So I want to reassure people that this is the only purpose for which this data is collected, and please urge people to complete that information. Moving on to our regular updates. Since the March 10th press briefing, we have 787 new cases of COVID-19 reported in the county for the dates inclusive of Wednesday, March the 10th through Tuesday, March the 16th. Excuse me. This is a daily average of 112.4 cases and brings us to a total of 48,664. These positive tests are all a result of a positive test for the virus. 11 were from long-term care facilities, 11 were from other congregate settings, and 765 are from our community. These positive individuals are from 58 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1 month old to 98 years old. And as always, you can check our maps at montcopa.org/ COVID-19. Today, we have 379 females and 406 males and 2 unknown. I am sorry to confirm that 9 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,244 deaths confirmed positive from COVID-19. These 4 individuals ranged in age from 62 to 95 years old. All 9 passed away in a hospital. Overall, we have now lost 632 females, 612 males to COVID-19. They ranged in age from 25 years old to 106. In terms of racial breakdown of those whose lives have been lost, we have 2 American Indian or Alaska Native, 34 Asian, 7 Asian Indian, 5 Asian Korean, 147 African American or Black, 648 white, and 401 unknown. Situation remains stable at the Montgomery County Correctional Facility. Anyone who has tested positive in the last couple of weeks is stable in isolation or quarantine as appropriate, and we continue to do regular antigen testing of all correctional facility staff that come into contact with individuals within the correctional facility. So our positivity rate continues on a downward trend, and great news today, our 14-day average positivity rate is down to 4.83% as of last Thursday, March 11th. This compares with 5.05% as of Thursday, March the 4th. So great news to see that we're finally back down under that 5%, which is considered suppression of the virus. We'll move on to the daily positivity rates, and you see also, of course, that downward trend for February 12th through March 11th. We can see that the county fell below 5% on 7 of the days in the last 2 weeks. So no surprise now that our running average is finally down below 5% again. Our hospitalizations continue to remain high, but have stayed pretty stable since last Wednesday. We don't have data for today. The state site was still updating, but as of yesterday, we had 110 individuals with COVID-19 hospitalized in a Montgomery County hospital. This is decreased from 121 2 weeks ago. And 4.5%, or only 5 of these individuals, were requiring a ventilator. So that's good progress. But again, I just feel required to point out that our hospitals do remain busy with COVID-19 cases. And as a reminder, on October 1st, there were only 24 patients hospitalized with COVID-19 in a Montgomery County hospital. So even though we're seeing a nice decrease here, we're certainly nowhere near to where we were even just a few months ago. People continue to be tested frequently, which is great. I want to continue to encourage anyone who wants or needs to be tested to be tested. We have plenty of testing available. For the 14-day period ending March 11th, 35,728 Montgomery County residents were tested, which is a decrease of 1,104 people tested compared with the prior 14-day period ending March the 4th. Here is our date tested graph, and as you know, the gray bars represent the number of positive cases on any given day. The red and the pink are the 7 and 14-day averages of total cases. The dark blue and light blue are the 7 and 14-day averages of cases from our community. And the orange and yellow are the 7 and 14-day average cases from long-term care facilities, way down there at the bottom. Next, we'll zoom in on the last couple of months, and you can see that we are seeing that nice steady decline since the holiday season. And I just want to thank everybody for the hard work that this represents. I know people really had to hunker back down again in order to get these cases down. And while, again, there is that light in the tunnel, we can absolutely see that light, we are not quite there yet. So please, even though some of the gathering limits are being increased, which is fantastic news, particularly for our restaurants, everyone does still need to use caution in how they conduct themselves when they're in places around people who are not members of their household. And as I said earlier, still doing testing at all 6 of our sites, and the hours vary from day to day, so please do check what the hours are at any particular site on any given day. To register for an appointment online, you can go to montcopa.org/COVID-19, click on the green County Testing Information button, and those appointments open at 7 a.m. for the day that you want to be tested. And of course, you can always register by phone at 610-970-2937 for all of our sites. That opens up at 8:30 in the morning. And we do have language line on that phone, so people can make an appointment in whatever language they're comfortable. And just, I think that's it for me. At this point, I'm going to turn over to Commissioner Lawrence.
All right, thank you, Val. I'm going to share information about 2 grant programs today. The first, I once again want to emphasize that the Montco Strong 2021 Hospitality Industry Recovery Program, that program is now open. And this is to help hospitality businesses who have been negatively impacted by COVID-19. The county has received $9.4 million from the state to give to eligible businesses grants from $5,000 to $50,000. The eligibility, application requirements, and program design were all developed from Senate Bill 109, known as Act 1 of 2021, signed by Governor Wolf on February 5th. In 2019, we know that tourism and hospitality accounted for approximately 4% of all the jobs in Montgomery County. And we know that with limitations on gatherings in the past year and on travel, the hospitality industry has been particularly hard hit. So we're happy that we're able to help these businesses until we can get back to some normalcy through this program. Eligible businesses must have their primary business activity in North American Industry Classification System, subsector 721, which is accommodations, or subsector 722, which is food services and drinking places. Interested applicants are strongly advised to review the program guidelines and frequently ask questions to assure eligibility before they apply. Program guidelines and instructions are available in English, Spanish, and Korean. There is also a 7-minute instructional video which walks you through the application process and offers tips and suggestions to ensure a complete application. This is not a first-come, first-served program. Grants will be awarded on a rolling basis, and the application window will remain open until all the grant funds are fully allocated. So make sure you take your time and allow enough time to fill out your application completely. Here's a quick update on the applications we've received so far. We've received 209 applications. 29 have identified as subsector 721, which is accommodations, and the rest identified as subsector 722, which is food services and drinking places. 45 of our municipalities are represented. 30% of the applicants have identified as a minority-owned business. 30% of the applicants have identified as a woman-owned business. 4% of the applicants have identified as a veteran-owned business. And 91% of the applicants have indicated they have been in operation since 2018. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. Questions regarding the program may be submitted through the Commerce Department's assistance request form on their website at www.montcopa.org/commerce. And that's where you can find all the information that I just shared. Due to the large amount of expected applications, feedback on applications will not be provided. And now I'd like to discuss a rent and utility relief program that the commissioners will be considering tomorrow. We know that many people across Montgomery County are still facing job loss and economic impacts due to the coronavirus pandemic. This has put a great strain on renters as they try to remain in their homes and landlords as they try to manage their expenses. The CDC's eviction moratorium is set to expire on March 31st, and the Pennsylvania Public Utility Commission's utility shutoff moratorium ends on April 1st. That's why we're extremely grateful to be able to open up another round of rent and utility relief to our residents as we continue on our road to recovery. The Montgomery County Rent and Utility Relief Program, administered by Your Way Home, allows eligible households to receive up to 12 months of assistance for rent and utility bills dating back to March 13th, 2020. Assistance can be for past due rent, utility payments, or future rent payments. Funding for security deposits and first and last month's rent is also eligible as part of this program. There is no financial limit on the amount of assistance that a household can receive. Montgomery County has $55 million available for this program through a combination of state and federal funding. With this amount of funding, we are aiming to serve between 1,900 and 3,800 households. Eligibility requirements for the rent and relief program include the household must reside in Montgomery County. One or more of the individuals in the household is qualified for unemployment benefits or experienced a reduction in household income, incurred significant costs, or experience other financial hardship due directly or indirectly to the COVID-19 pandemic. And the household can demonstrate a risk of homelessness or housing instability. Households must be at or below 80% of the area median income at the time of application. To apply, residents are encouraged to call 211 or text their zip code to 898-211. Applications can be done over the phone, in person, emailed, or a combination. Residents can also reach out to one of these 6 partner organizations to learn more about the program and apply. And those organizations are CLAMO, Family Services of Montgomery County, MANA on Main Street, YWCA Tri-County Area, CADCOM, and the Pottstown Cluster of Religious Communities. All of this information can be found online at www.yourwayhome.org/ERUC, or you can call 211, as I mentioned before, for more details. Anyone who lives in Montgomery County that is struggling to pay their rent or utility bills are encouraged to apply, and we are accepting applications on a rolling basis. That concludes my report, Val.
Great. Thank you, Ken. So I have no further announcements. So other than a reminder that our next briefing will be next Wednesday, March the 24th at 1:30 p.m. And I'll be happy to take questions.
Our first reporter will be Krista Shoemaker from the Intelligencer.
Good afternoon. 2 questions. You mentioned that you would be requesting the maximum allowed doses next week. How is that maximum determined? Is that specific to Montgomery County, or how is that the maximum?
The Pennsylvania Department of Health determines the maximum, and when my team goes online to put our request in, they can see that we are able to ask for up to a specific amount. And so we asked for the maximum that we were allowed to order. In terms of how PADOH determines our maximum for a particular county, you'd have to ask them.
Okay. And the president has said he would like to see appointments open to all adults by May 1st, and that most vaccinations be given by the 4th of July. Do you think we can hit that goal? What needs to happen to be able to do that?
Well, first, let me be clear that I would love to meet that goal. I think everybody listening absolutely wants us to meet that goal. I believe that we have the capacity to deliver enough vaccines to meet that goal. The one piece of this that is not under our control here at the county is how much vaccine we receive. So we did get some good news in the last several days about more Johnson & Johnson coming into our state. And we're very hopeful that we're going to get our fair share of that vaccine. We will be ready to give it. So I hope we get enough to meet those goals.
That's it for me. Thank you very much.
Next, we'll go to Jim Melward from KYW.
Good afternoon. Monday, you may or may not have heard, I asked the governor if he expected 1A appointments to be scheduled 4 to 5 months out, and I was quoting Montgomery County numbers specifically because I had them in front of me. He basically literally laughed when he said they wouldn't be scheduled 5 months out. With everything you told us today, and I know you touched on it, what's that look like when you hear the top state official laugh at the 4 or 5 months, which you're staring down the barrel of? What's that look like from your vantage point?
Well, Jim, as you know, I have followed one principle every day of this pandemic since our first press briefing on March the 8th, which is I am honest and transparent with the people who live in Montgomery County. And all I can tell you is that at our current rate of receiving vaccine doses, that is our best estimate, somewhere in the 4 to 5 month range of how long it will take us to get those 127,000 people scheduled. I mean, we can give them appointments, but it will take that long to actually administer the vaccine. Now, if there's something that's going to change, perhaps the governor is aware that we're going to get a lot more doses than we have been made aware of here on the ground. That would be such welcome news. And as I said earlier, we are ready, so ready to give those doses. So I just have to hope that maybe there's some information that hasn't been shared with us yet. But my job here today is to tell our residents with what we have and what we have been told we will receive, our best estimate for getting through the 127,000 people in our line.
And have you relayed that to the state that you're looking at scheduling 4 to 5 months out, and that may not be, and maybe it is, but it doesn't seem to be beneficial to anyone scheduling that far out with the unknowns between now and 5 months from now? Have you said that to the state, and have they responded?
We've communicated directly with the state our best estimate of how long it would take us at the current rate of delivery of vaccine to schedule the individuals in our line, and we have requested that we get more doses.
And last question, now that now that you're to January 18th, and I don't have that list in front of me of how many people signed up each date, but it seems like those first few days were really big numbers, like tens of thousands, and then it kind of goes down. Do you expect, now that you're through those big numbers, that you can catch up, or does it still kind of work out? Does the math still kind of work out where you'll be playing catch up several months behind when people signed up to when they actually get scheduled, or when their appointment actually comes up, I should say?
So I'm not exactly sure what you mean by catch up, but what I can say is that we did have on January the 13th, 30,000 people signed up, and on January the 14th, 19,000 plus people signed up. And since those were our biggest 2 days, and so many other days after that were more in the order of 5,000 to 6,000 people signing up. So we will absolutely be able to start moving through this line a little more quickly. But again, how quickly that is will depend on how much vaccine we receive here at the county, and if individuals are to find vaccine appointments through other providers that are providing vaccine.
Thanks.
Next, we'll go to Kelly Rule from Fox 29.
Afternoon. So I know you mentioned that a proposal was submitted for Montgomery County to have the regional vaccine site. I understand there was a call with Acting Health Secretary Beam today. Is that how they're going to decide the location? And is it your understanding that there's only going to be one for all 4 counties?
So first, I think it's important that people understand what the county's role is in a public health emergency. And the state of Pennsylvania tasks counties with having medical countermeasure plans that are to be used in responding to a public health emergency that requires emergency vaccination or administration of antibiotics to our populations in case of a public health emergency. So the 4 counties in the Southeast all have those plans. Those plans are done between departments of health and departments of public safety. We have all been activating those plans, those pre-existing plans that we have spent years developing, that we do drills with every couple of years. And we have conveyed to the state that our plans are ready. We have stood up facilities. All 4 counties in the Southeast have unused capacity to administer vaccines here in the Southeast on the order of thousands of doses a day across our 4 counties. And with the goal of making sure these doses are distributed equitably and as quickly as possible to work through all of the 1A waiting lists that all 4 of our counties have. We are conveying that it is our strongest preference that we continue to have these sites in our county so that they are much closer and more accessible for everyone in our community, and that we simply do what the state has always asked of us, which is to be the first responders in a case of a public health emergency requiring vaccination or administration of antibiotics. We answered the call, we're ready, we're just asking for the vaccine.
So at this point, you're not necessarily, because of the way I read that, that portion of the letter, it sounded like they were looking for a site similar to the FEMA site in Philadelphia. Obviously, it'd be through FEMA, I guess. But you're saying that you'd much rather just get the allocation that you're requesting and be able to do it individually in each county, since you're prepared to do that.
Yeah, we're conveying to PADOH and the governor and the task force, number one, how happy we are that there's more vaccine coming into our region. We are extremely pleased about that. And we are simply being asked to do what we've been always tasked to do, which is activate our medical countermeasure plans. Those plans are put together thoughtfully. They take into account the needs of all community members in our communities. They lead to the location of sites that makes it easier for all people to get to them. The 4 of us do share concerns that with only a single location in our region, you would really have to have a car in almost all cases to get there. The drive times could be extensive, and we worry that this will only further deepen the inequities that we are already seeing in the distribution of this vaccine. So we're trying to get everybody vaccinated as quickly as possible, but always keeping an eye on the equitable distribution of that vaccine.
Awesome. And my last question, in the letter that was sent from the acting health secretary, she did address some of the concerns, including, regarding the data. And I know for weeks now you've been saying you have not been able to see, the hard numbers behind those county percentages. Do you feel like her letter addressed or provided you with some of those numbers you were looking for, or is that still an issue?
There is more data available now on the website, which we're very pleased about. We have not had a chance to fully take a look at that data, but we're extremely grateful that they have made more data available to us.
Thank you.
Our next reporter will be Deanna Durante from NBC 10.
Piggybacking off of Kelly's question here, I just want to again tackle the Department of Health letter that was sent out to the Southeast delegation last night. First, that they talked about the concerns that legislators and counties have on vaccine distribution, saying that what you're getting is equitable. Do you disagree?
I think we all share, and I don't want to speak for the governor or for the Department of Health, but I think they've been consistent and we've been consistent in focusing on equitable distribution of these vaccines. And I think if you look around our 4 counties and all the work that we're doing in terms of where we have located our mass vaccination sites, whether they're open yet or simply potential sites, and what we're all doing with mobile vaccination, taking vaccine to some of our most vulnerable communities that don't have good transportation, particularly seniors, I think that you'll see that because of these long-standing plans that we've had in place, we were ready to and prepared to deliver these vaccines equitably. And so I hope that we can all have a chance to continue this discussion, because we absolutely share that goal. We want to get these vaccines out there as equitably as possible and make sure that we don't leave anyone in our community behind in this effort.
Your long-standing plans that you've had in the county, is that in accordance with the way that the state has done this rolling out, or has it created issues because your plans that you've practiced for and had long-standing are different than how they're carrying it out?
We have seen some differences in terms of how this is being carried out. We saw in the early days quite a few providers being approved and receiving vaccine. That would not be a typical approach in the early days of a pandemic. That's a critically important component of this. Once the vaccine is no longer scarce, I want every single neighborhood pharmacy and other location to have this vaccine. But in these days when the vaccine is still so scarce, and we know that we have these highly contagious variants in our county and in our communities, we just want to get the vaccine out as quickly as possible. So that has been what our plans are built around. But I also have to point out that we do have smaller communities, particularly bilingual communities and other populations where we do need to make sure that we are getting vaccine to trusted community members who speak the language of particularly immigrant members of our community. So there's a balancing act there. And that is why we have these plans in place, so that we make sure that we hit all people, we're able to reach all members of our community.
When you talk about equitable, the Department of Health had a press conference the other day talking about efforts to reach more people, either that the data is incomplete, that other ethnic and other than white people are getting the vaccine, basically. I mean, when you look at the state bar graph, it's Caucasian and whites, it's a huge chart, and then all of the other races and ethnicities are barely registering on the chart. What does that say about the way that the state and the way that the county is getting this vaccine out if we're seeing it not going across all races?
Well, I can only speak to the data that we have here in Montgomery County. And as I just reported on, that we are seeing 1 in 5 people who are not identifying their race and 1 in 3 people who are not identifying their ethnicity. So that is a significant proportion of the people who live in Montgomery County and have been vaccinated. We don't know exactly why that's happening. Some individuals may be understandably concerned about identifying in such a way. We have unfortunately, once again, seen an uptick in some anti-Asian sentiment here in this country. And again, I absolutely say there is no place for that in our county. But so it's somewhat understandable why people might not want to identify. But we also don't know if certain providers maybe are not taking the time to get that data entered. You know, it's a complicated process to some extent. So we just want to urge every individual and every vaccine provider to do their best to enter that data, and then for the state to make that available to us so that we can use it to be smart in how we target our vaccine delivery to certain communities.
Are we limited to 3 questions, or can I ask one more?
You can ask one more, that's fine.
Okay. So I'm seeing in the Facebook chats, the people that are reacting, and one of the things that they bring up is, you know, you have this waiting list of 137,000 last week, 127,000 this week. Is there a way for people to go on and cancel if they do find it, if they do drive 2 hours, or if they do get it from CVS, can they go back on and cancel to let you know, or do you have to go and recheck with them?
It would be terrific if people would let us know that they no longer need a vaccine appointment. They can send an email to covid19@montcopa.org. And in the subject line, they can put unsubscribe or no longer need an appointment, you know, just anything that would indicate that we can take them or remove me from the list, you know, anything that's simple for them to type into that subject line. So again, it's covid19@montcopa.org. And we do need their name, the name that they use to register, the email address that they use to register, and their date of birth, and then we'll remove them from the list.
Okay.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Hi, Commissioners. If we can go back to the call that you had today with the Department of Health, I mean, what was their reaction? What did Acting Secretary Beam or others on the call say, you know, in reaction to the county's ask that you just get more doses for the existing clinics rather than setting up, you know, one single clinic?
Well, first I want to stress that we have a number of shared goals that it includes getting this vaccine out as quickly as possible, particularly here in the Southeast, working through our long 1A waiting list and then expanding eligibility after that, and doing and meeting those goals as equitably as possible. So I think we all share in those goals, and we presented to them an alternative to a single facility that is somewhere here in the Southeast. And we reiterated to them that all 4 of us are ready. We have unused capacity that currently exists to deliver more vaccines. And using that capacity will in no way slow down or hinder our ongoing vaccination with Pfizer and Moderna of 1A individuals. So we just conveyed all that to them. And there wasn't a lot of time for the meeting. Everyone's pretty tightly scheduled right now, but we did convey that information to them, and there will be additional conversation.
Okay, and do you have any indication of, do you have any other meetings scheduled with them or talks scheduled coming up? Do you know when you might hear something back?
Well, we will continue to talk, and I don't think we actually figured out when we're going to talk, but it will be soon.
Okay, and do you have a sense of whether doses to other providers in Montgomery County, aside from the health department, have received an increase and been able to ramp up at all?
I do not. I have kept in, we have a weekly conversation with our hospitals. I think they have stayed pretty much steady state, so I can speak to them a little bit. I have not had a chance to research whether or not pharmacies or doctors' offices have received additional allocations from the Department of Health. However, I do believe that we are starting to see more doses come in through the federal retail pharmacy partnership. And I want to be clear that the Pennsylvania Department of Health does not control that allocation. This is a federal program that President Biden has started to send doses directly from the federal government to retail pharmacies. And I do believe we are starting to see a bit of an uptick in those doses coming into the Southeast region. But I can't quantify it.
Okay, thank you. And I was curious if you or anyone else has pushed for anyone from the counties to join the state's task force, or for you to be, in their meetings going forward or consulted in some way.
We actually made that request today.
Okay, thank you.
Our next reporter will be Carl Hassler from the Pottstown Mercury.
Good afternoon, Commissioners. When the Willow Grove facility opens on Friday, will it just be offering first doses, or will it eventually also offer second doses? What will be the breakdown between the 3 clinics and what they're offering?
So generally speaking, we're going to move to offering 500 first doses a day at each of the 3 sites. As you know, we're currently doing 1,000 first doses at one, and then approximately 1,000 second doses at the other. So we're going to change that so that it's 500 at each site of first doses. And then all 3 sites will have capacity for when people are ready to come back for their second dose. So they'll come back to that same location. So we'll be moving toward something closer to 1,500 doses a day of first doses instead of the 1,000 a day first doses, and then having the space to do the second doses as well. The Willow Grove facility can accommodate at full capacity 10,000 shots per day of whatever combination that would be. So first and second doses, or if it were J&J, just 10,000 doses. So it's at full capacity, which we could achieve in just a matter of days if we had the vaccine doses. It could give up to 10,000 shots a day.
Okay, so beginning for people who are going to start pre-registering for those shots at Willow Grove, they'll be able to select the location where they want to get the first dose, correct?
The way it'll work is that if you're next in line and we send you vaccine appointments, you will be able to see which locations are available for that particular day, and then you could pick which of the locations that you wanted to go to.
Okay. And one other question, has the county been informed, do you have any idea how much pandemic relief the county will receive under the rescue plan that's now been approved by the federal government? Have you received any dollar amounts of what you might be receiving?
I think the county has received an approximate dollar amount. I do not have that at my fingertips, but we'd be happy to get back to you with that information.
Okay. And you don't know when that might be coming to you?
I don't have a date. I think that date is at least approximately known, but I don't want to misstate it. So Kelly will be happy to follow up with you after this.
Okay, thank
Val, I
you.
think it's 161 million that we're receiving. I don't know the date that we should receive it.
Okay, thank you. That's all I had.
Thank you.
This concludes our questions for today.
All right. Thank you, everyone. See you next week.